Hey guys, Darren here, the COPD guy. I just wanted to come back with you on the last video. We talked about what COPD stood for and that it was a combination of chronic bronchitis and emphysema. So let's go into that just a little bit further on this video. Chronic bronchitis. It's defined by a chronic productive cough for 3 months in a 2 consecutive year period. So a chronic cough for 3 months over a 2-year period, anytime in that 2-year period. That's chronic bronchitis. It's characterized by inflammation and excess mucus in the bronchial tubes themselves. So you're coughing, you have an irritation, you cough, and when you cough, you're coughing up a mucus. And that mucus is coming out from your bronchial tubes. Common signs: frequent coughing with mucus, respiratory infections, especially as it progresses, or if you are becoming more sediment or don't have a very active lifestyle, and shortness of breath is some of the common signs of chronic bronchitis. The pathophysiology of chronic bronchitis is that it actually thickens the bronchial walls, and it makes it much harder for airflow to move through. Increased mucus production and blocks in these thickened walls then blocks your airways and makes it more difficult for you to breathe. So that's the chronic bronchitis pathophysiology. For emphysema, it's damage to the alveoli itself, the air sacs in the lungs, that leads to difficulty of breathing. It creates shortness of breath, especially during physical activity. You can get what we call a barrel chest appearance. You have a sudden increase in weight loss and a much reduced tolerance for exercise. The pathophysiology for emphysema is destruction of the alveolar walls, or the walls around the air sacs, resulting in larger air sacs, but they're much more less efficient in allowing gas exchange to occur, which is allowing the oxygen to come in and the CO2 to go out. So by having the larger air sacs where they're not as efficient, you run into increased CO2 levels from your inefficiencies in breathing. Lung loss of elasticity and collapse of small airways during exhalation, and it traps the air inside your lungs. So someone with emphysema, if you think about this, if you take a great big deep breath in and you only let a little bit out, and that's what you're breathing on, you're not allowing your full exhale. You're just breathing from the top portion only, and that's not sufficient enough to allow gas exchange to occur, and it leads then to respiratory failure and other issues. On the next video, we're going to talk about the 4 stages of COPD. Remember, if you like this content, please remember to hit like and save and subscribe, and share if you'd like to as well. I'd like to get this out to as many people as we possibly can. On the next video, 4 stages of COPD. Thanks, and have a great day.